Now I will show you how to apply a successful corporal DERMOHEALTH session. DERMOHEALTH is a non-invasive method of continuous vacuum at a constant flow that activates skin tissues and stimulates microcirculation. In this way, it is easier to remove toxins and deposits of excess body fat, and the adipose panniculus is reduced. It contours the body and reduces volume, and it heightens lipolysis in the deepest fat levels.
Unlike other vacuum therapies on the market, this therapy uses a high-revolution axial turbine, 17,500 RPM, and it can reach flows of 35 liters per second and a constant suction of 180 mbar. Such suction and the action of the fixed rollers produce an undulating effect on the tissue and activate microcirculation. This system protects the skin and tissues from damage.
In conventional systems of vacuum therapies that use a pump, tissues suffer from compression and decompression since the pump works at low flow and higher pressures, so tissues are likely to get damaged. In order to control this action, mobile rollers are used. Thanks to the technology used by Body Health, it is possible to achieve better results in fewer sessions.
The treatment must be applied by highly qualified professionals trained by Body Health to ensure a correct application.
Now, let's see how a successful corporal DERMOHEALTH session is carried out. Step by step, you will clearly see how to achieve the best results in fewer sessions.
The sessions must be carried out in a room or beauty salon booth of 2 by 3 meters at least. The place must be quiet and well ventilated. If possible, it should be air-conditioned or properly heated. Dim light is ideal.
The session will be carried out in silence so that the patient can relax and the therapist can work efficiently.
The patient wears a lycra leotard with neither seam nor elastic. The leotard has to cover lower and upper limbs completely up to the neck. Patients must not wear underwear. The material must be elastic so that the head can slide smoothly without slipping. Patients with circulatory disorders should wear a white leotard so that circulatory problems can be easily seen. The patient is in a ventral decubitus position with her head to the right of the operator. The therapist stands next to the stretcher, diagonally from the patient, and must cover the patient's body with her right arm. She must semi-flex her knees, contract her abdomen, and relax her arms and shoulders. She will hold the head's handle with her right arm without flexing or extending her wrist, as a bad movement of her wrist might cause tendinitis. Her left hand must be placed on the other side of the head. This hand commands the movements of the head as it does not bear any weight. The equipment is placed behind the therapist in a diagonal position.
The selection of programs depends on the operator's experience.
Beginners should use a manual program with a power of 70% for 35 minutes. An experienced therapist will be able to use the manual program or select the most suitable treatment from the pre-selected programs. An advanced therapist can build up his own programs for each case. The maneuvers. There are 3 different maneuvers as it is necessary to activate the connective tissue and carry out a drainage at the same time. First, lymphatic drainage maneuver. Go down with the head diagonally from the ganglionic point to the distal area. Turn the head 90 degrees and slowly go back to the ganglionic point. Cover all the area to be treated applying the same maneuver. This is the maneuver that will deposit the fat, detritus, and all the lymphatic content in the ganglions. And for this reason, the therapist will always alternate it with a mobilization maneuver, as it would be a big mistake to activate the tissue to be treated without removing it through the lymphatic system. Therefore, the therapist always has to start and finish with a drainage maneuver. The other 2 are connective tissue maneuvers. The objective of these maneuvers is to make a neutral tissue without circulation, non-contractile, stagnant, become active. These maneuvers are butterfly, applied perpendicularly to the drainage maneuver with twists of 90 degrees twice. Then, with the drainage maneuver, go back to the ganglionic point. The area to be treated is covered as from the area close to the distal one. The direction of the maneuver is not so important because the drainage will be carried out later. The butterfly maneuvers are specific for cellulite and localized obesity. The second maneuver is cheaping. The cheaping maneuver consists in applying a kneading movement with the head, detaching it from the back roller without lifting the fore roller. The cheaping maneuvers are used to treat very localized areas of cellulite and localized obesity, for example fat pockets, lower abdomen, etc. The lymphatic drainage maneuvers are used in all cases without exception. In order to apply the maneuvers, no function must be selected. The operator must be in charge.
Now we're ready to start the patient's treatment. Follow the instructions step by step and you will be able to achieve the expected results in a very short time. Remember to follow the instructions in the manual that corresponds to the equipment that is being used, so as to program the machine correctly.
The patient is in a ventral decubitus position with her head to the right of the operator. The therapist will hold the head with her right hand. For each area to be treated, the sequence of maneuvers is the following: lymphatic drainage maneuver, connective tissue maneuver, lymphatic drainage maneuver. In most cases, the following sequence is used: lymphatic drainage maneuver, connective tissue maneuver, butterfly, lymphatic drainage maneuver. In the case of treatments for localized obesity and cellulite in localized areas, the following sequence is used: lymphatic drainage maneuver, connective tissue maneuver, cheaping, lymphatic drainage maneuver. These sequences must be repeated as many times as necessary. It is important to remember that the whole body must be treated. It must be divided into different parts, which will be treated conscientiously and systematically. The area must be totally covered, with no exception. The therapist starts with the paravertebral, contralateral muscles and the back area. This initial position is important so as to allow the ganglionic opening of the dorsum, the armpit, etc., and to allow the drainage of the area as well. In each body segment, the therapist starts with a ganglionic unblockage due to the effect of the vacuum of the head that is placed on the ganglion. The side that is contralateral to the operator must be always treated first, because that is the area on which she exerts pressure first. Then, she rests when she treats the homolateral side. From the sacrum, the therapist moves on to the paravertebral homolateral muscles and the back. The ganglionic part of this area is the paravertebral ganglionic chain. The therapist continues with the contralateral upper limb, in which the ganglionic point is the axillary one, and then she passes on to the homolateral upper limb. The position of the two upper limbs is the following: extension of the forearm at 90 degrees with respect to the body and a flexed arm hanging from the stretcher. The arm and the forearm next to the body with the palms upwards. If the treatment for upper limbs is not needed, use the position